Hi, my name's Christine Size, and I'm a senior at Washington State University Global Campus. This is my capstone project for Psych 265, and it's on marijuana and pregnancy. I chose this subject because I'm an old hippie, and I had my kids back in the 70s when the hippie era was going on, and the slogan for moms at that time was marijuana makes beautiful babies. We really believed that, and a lot of us smoked pot while we were pregnant. Does marijuana really cause problems with the fetus? And with the trend of legalization and increased use, this is going to be an important topic. The earliest evidence of cannabis use during childbirth was found by Israeli scientists recently. They dug up the body of a woman who had died in childbirth buried with marijuana residue. It was about 1600 years old. Also, ancient Egyptian and Assyrian writings talk about using marijuana for childbirth, probably because it increased, helped the baby, the childbirth process, and it decreased the pain. Nowadays, you can read on the web and certain blogs that marijuana is good for morning sickness. It is good for nausea, but there's a lot of other things you can use besides that. With legalization, will more women be willing to self-report? Usually in prenatal visits, they screen for alcohol and tobacco use, but marijuana use isn't typically screened for, and that might change, hopefully, with education. Studies that were done on effects of cannabis use on developing fetuses in the 1980s were mostly inconclusive. They were done on birth outcomes. There's really no evidence that it affects or causes preterm birth or low birth weight or congenital anomalies. Tetrahydrocannabinol, THC, does cross the placenta and it crosses into the breast milk, so the baby gets it even after birth if mom keeps nursing and using marijuana. There are two receptors for the THC, CB1 and CB2. CB1 lies predominantly in the regions of memory, cognition, motor control, and mood. And CB2 is mostly in the immune system. There was a study just this year done by Zhang and his cohorts, which researched in depth the results of studies that were done over time, like over 10, 12, 14 years after the marijuana smoking mom had her baby, and checking up on the kids. While there were no immediate effects noted at birth, by age 3, there were definite verbal and memory deficits noted. And by age 6, it's associated with a 10% difference in IQ scores. By 9 to 12, there's a 10% greater score for impulsivity and hyperactivity in these kids. Delinquent behaviors are evident by age 10, along with cognitive deficits and poor school performance. These kids had a greater chance of using marijuana and tobacco later in life, whether that's by modeling from the parents or but they had a greater chance of childhood cancers. And that might be because the CB2 receptors in the immune system. I don't know. The gist of these studies show that indeed babies may be beautiful at birth to marijuana smoking moms, but the problems come later in life with the cognitive and behavioral difficulties. And with the increased legalization, and I don't know, but in our little town, there are 5 pot shops on one city block. It's quite an epidemic here, and education needs to be done. There's a lot of education gone forth about tobacco and alcohol, but there's really been none about being pregnant and smoking marijuana. And I hope to change that someday. Maybe this video will help. Thank you for watching it.